All right, everybody, smile. We're on camera, we're recording, we're streaming live. And I think, Krista, we could probably go ahead and get started.
Okay, great. Good evening, everyone. My name is Krista Siringo, and I am a Bristol representative to the MAUSD School Board. I have 3 children in our schools, twin daughters that are entering 9th grade, and a son who's entering 5th grade. I'm guessing some of the things that I've been feeling and wondering about during this uncertain time might be similar to things you've also been wondering and feeling and experiencing. This evening's community town hall will give you an opportunity to hear the most current details about going back to school as we know them right now, and also give you the chance to ask questions that may be on your mind. It's our hope that this will help ease some of the concerns you might have, while also recognizing that there will likely still be uncertainties and unanswered questions as we move through the fall. We're going to start the evening with a presentation by our superintendent, Patrick Reen. Patrick will talk about the current plans for many different aspects of our school system, from transportation to food services to academics. After the presentation, you will be invited to submit questions through the Q&A function on your screen. And those questions will be answered by Patrick or other members of the team that have helped to put these plans in place. We'll be grouping and possibly rephrasing questions to cover a wide range of responses. We have a hard stop at 8:30, so if we don't get to your specific question, please feel free to submit it to covid.help@mausd.org, and someone will respond to you as soon as possible. Shannon Warden, the principal of Mount Aid Middle and High School, is going to go over a few tech housekeeping items. Before I hand it over to Shannon, I would like to publicly thank all of our administrators and staff members who have been in overdrive since the pandemic arrived and have continued working tirelessly since then, trying to adjust to this new reality in a way that ensures our kids still can get the education they deserve. This is an incredibly challenging time for everyone, and these folks have stepped up in a tremendous way for our community. On behalf of the school board and as a parent and community member, I would like to say thank you. Okay, Shannon, I'll hand it over to you.
All right, Krista, thank you. Thank you all for joining us. Just a couple of things. On the very bottom of your Zoom window, you will see a tab or a little button icon for Q&A. We're going to be utilizing that this evening instead of the chat feature. We have a number of folks working behind the scenes to comb through all the questions and answers and combine ones that are the same so we don't have duplicates. So if we could also refrain from using the Q&A for comments and just for questions, then we can get to more questions throughout the evening. At the top of your Zoom window or screen, you have an option to view the gallery, which will be all of the panelists at one time, kind of in a grid like the Brady Bunch, or you can choose speaker view, so you're not trying to figure out which one of us is speaking, and whoever is speaking will pop up first. All right, and if you have any issues, I keep my email open at the same time. You can send me an email if you're having an issue. Sometimes just logging out and logging back in will correct some of those problems. So thank you all for joining us tonight, and I will pass it over to Patrick.
All right, thank you, Shannon, and thanks, Krista, and thank you everyone for being here tonight. I hope you find it really useful. I want to also thank our steering committee and our action teams who have been helping to do a ton of work to get our plan for reopening schools during this pandemic kind of ironed out. And I especially want to thank the MAUSD staff for all of their efforts in the spring and for what I'm sure are going to be heroic efforts as we reopen in the fall. Though these are clearly challenging times, I'm very pleased to be and proud to be working through these challenges with such an amazing team here at MAUSD. Can't say enough about how everyone has come together to support our students, our families, and our community. But we don't have all of the answers yet, and undoubtedly this pandemic will keep us on our toes for some time to come. I have tremendous confidence that MAUSD will rise to the occasion. So before I jump into my presentation, I want to introduce some folks that we have on the call tonight that are going to help answer some questions. And when we get to the Q&A portion, I'll likely call on some of these folks to help fill in some of the details of the planning that's happening. These are all either leaders of one of our action teams, which we'll talk more about in a minute, or our directors of programs that I anticipate you might have some questions about. Our panelists tonight include our Assistant Superintendent, Katrina DiNapoli, our Director of Student Support Services, Susan Bruhl, our Business Manager, Floyd Davison, our Food Service Director, Kathy Alexander, our ELP Director, Mandy Chesley Park, and her Assistant Director, John Amory, our Director of Student Support at Mount Abe, April Wortman, Principal at Robinson Elementary School, Adora Fraser, and Assistant Principal at Mount Abe, Justin Bouvier. So as I said, I do have a presentation that's going to take you through some of the information that we've gathered and some of the plans we've put in place so far. And then we're going to turn it over to the Q&A that Krista is going to help facilitate. If we don't have time to answer any of the or all of the questions that are submitted tonight, we're going to capture those questions and do our best to address them in some sort of an FAQ document or some other way. So I'll apologize ahead of time if we can't get to them all, but we will work to make sure that those answers do reach you at some point down the road. So with that, I'm going to share my screen and I will walk through the presentation. And actually, Shannon, I need you to give me permission to be able to share my screen, please.
Oh, all the power. I just did.
All right, let's see, Justin, I can see you. Can you give me a thumbs up if you're able to see this shared screen? Great, thanks. So I want to start with a little overview of just some of the layers of decision-making that we've been kind of going through as we've been building our plan for reopening. So at the top of this pyramid, you can see a sort of state level health and safety guidance. So this is information coming from the Vermont Department of Health and the Agency of Education. And this guidance is really critical for our planning and sets the stage for the details that follow. It's a combination of directives. There are some things that are have-tos, and there are many, many recommendations which are not necessarily have-tos, but obviously come with sort of the backing of the Department of Health and the Agency of Education. So we then, as regional educational partners, so thinking about the Champlain Valley group as our region, our superintendents work really closely together to sort of understand and digest the state level guidance that can be interpreted in different ways and work together to try and be as consistent as we can throughout the region, knowing that we have really different systems, different sizes, et cetera, but really still trying to be as consistent as possible for the sake of everyone in the region. From that level, once we make some of those decisions regionally, our action teams work to sort of understand the regional decisions, but also the state level decisions, and make recommendations that are then specific for MAUSD. So these action teams, of which there are 7, really fed information up to the steering committee, which is the next layer down, for consideration and some decisions for district level needs in MAUSD as we've been looking to reopen schools. From that point, each school has some specifics about it that they would then take that information from the district level and apply it to their unique situation in their school building. And so that's led by principals working with their school leadership teams to make those decisions. So as you can see, many, many layers of decision-making involved in building the plan for reopening. This graphic helps to show a little bit of the structure for our reopening. And you can see here how the different steering committees work to provide information to, the different action teams work to provide information to the steering committee for action. In those teams, we had a public health team, social, emotional, and mental health team, continuity of learning team, a personnel team, school meals team, communication team, and transportation team. And a lot of these leaders of these teams are the folks that we have tonight as our panelist group, among a couple of others. So it's really important as we have so many moving pieces and so many competing interests that we have our priorities really clear. And for us, our priorities, which are really clearly established, are first and foremost, we need to make sure that the physical health of everyone, staff and students, as well as the impact our systems have on our greater community, is our first priority. So when we have decisions that may sort of rub the physical health need and the continuity of learning need, the physical health need is what's going to win out. Our second priority is the social, emotional, and mental health needs of, again, our students and also our staff. We recognize we're coming out of 5 months where students haven't been in school. It's an exceptionally long period of time. There's obviously a lot of anxiety around what returning is going to look like, and that's real. And despite all of our efforts to make sure everyone's physical health is as safe as it can be, we know that people are still coming with social, emotional, and mental health needs, and we need to tend to those as well. So a lot of effort being put into making sure that that's taken care of. And then thirdly, continuing our focus on our continuity of learning, making sure that student learning is progressing, that we're attending to student academic needs, and having our system of supports in place to support our students. So very clearly our 3 priorities, and I've arranged our presentation tonight around those top 3 priorities. And I fit some of the other areas, like we've been talking about transportation and food service. I've sort of fit those into these 3 priority areas. So the first priority that we're going to talk about is physical health. And so within physical health, facial coverings and distancing is obviously something that's on everyone's mind. Those are really key factors in our ability to bring students back safely. So it is important to know that face coverings are required for everyone with very few exceptions. We are asking families to send at least 2 face coverings. This will give students sort of a backup if one of them gets dirty or lost or whatever it might be, so that we can be sure that everyone is going to have a face covering with them. We will have some face coverings on hand, so if a student can't find one or lost one, or you aren't able to provide one as a family, we're going to make sure that we help meet that need. It is important to know that face coverings must have at least 2 layers and no vents in those face coverings. There's some pretty clear evidence that a single layer is far, far, far less effective than a double layer face covering. So please make sure that your face coverings meet that. Face coverings can be removed at certain times during the day while students are eating and or drinking or outside, as long as 6-foot distancing can be maintained. And students, even if they're going outside and they know they're going to be able to maintain their 6-foot distancing, they need to bring that face covering with them. So they should have it with them at all times in the event that something changes and they have to have that face covering on. So really critical piece of information. So very recently, the guidance changed a bit in terms of how far spaced out students needed to be. Originally, and for quite a while, the recommendation from the Department of Health and the Agency of Education was that students needed to be kept at 6-foot distances from one another. Though we do experience significant declining enrollment in MAUSD, we still found that was going to be really challenging to bring our students back and keep them 6 feet apart. So that was the initial reason why we decided to open in a hybrid model that allowed us to bring half of our students back at any one time and make sure that we can keep proper distancing. Very recently, that guidance shifted to allow 3-foot distancing for students in grades pre-K through 5. And that certainly opens the door for considering bringing back more K-5 students. But with so much planning underway in the hybrid model and the realization that there are many, many logistics and various practices that are going to be changing that we need to try out and make sure we have working well before we bring everyone back, we decided that staying with a hybrid reopening was really the way to go. And we'll be assessing that situation as our reopening moves forward. We'll pay attention to what's happening more statewide or regionally with the pandemic, and we'll consider the possibility of bringing more students in down the road. But for right now, we're going to continue reopening in a hybrid model. And again, just for everyone's physical health, there aren't going to be any indoor assemblies or other large gatherings until further notice. Really hard to know how long that will be, but we know bringing large groups of people together isn't a good idea, at least for the time being. So sticking with physical health, I want to talk a little bit about travel, because I think there are various reasons that people may be traveling here toward the end of the summer. And And so students or staff who do travel, even if it is a day trip, if you go to a county that has more than 400 cases per million, that individual is going to need to quarantine according to the governor's order. So that could be quarantining for 14 days, or you can quarantine for 10 days and then get a test. And then assuming the test is negative, you could return a little bit sooner than the 14-day period. Obviously, you know, that map changes, I think, on Fridays. So it's important to check the Vermont state website and look at Vermont's cross-state travel map for more information about which counties on any given day have more than 400 cases per million. And also anyone who travels by mass transit, bus, train, airplane, that does require a quarantine. So really just the New England states and New York are included in the travel map. But if you're traveling outside of those states, in particular if you're traveling by mass transit, it does require the same quarantine. One example, if I go back to that for a minute, families dropping off an older sibling at college. If that college is in a county that is that has more than 400 cases per million, even that one-day trip over and back would prompt the need for a quarantine. So I have school meals also under physical health for nutritious reasons and others. It's important to know that school meals will be made available. We are going to be serving kids food. It will not be served in the cafeteria. We're going to be serving meals in classrooms, and students, in particular breakfast, will be able to pick up breakfast at kiosks with distancing in place and masks on to bring that breakfast to their classroom. So the meals will still be consumed in their classrooms. We are also going to make meals available to take home for those remote days. So more information will be coming out in terms of exactly where and when and how to pick that up. And Kathy is on the line to answer questions when we get to the Q&A if you have some questions about that. But we are going to make sure that food is available to students on their remote days. The costs are going to be the same as they've been in the past, sort of pre-COVID. I know we've been doing a lot of free meals. There's some different regulations around summer meals and our ability to offer those free of charge. And when we were in our sort of our remote mode in the spring, March through June, we were given the ability to offer meals through a summer meal program, which allowed them to be free of charge. So that doesn't really apply anymore when this new school year starts. So it'll be the same fee structure that we've had in the past. And families are encouraged to apply for free and reduced meals. That's something that needs to be done annually. And obviously a lot of families are finding themselves in some different financial circumstances. So we definitely encourage people to apply for that. And the thresholds are fairly high. So hopefully a lot of folks become eligible, and that's something that can take a burden off of your home life. Sticking still with physical health, talking about hygiene and cleaning. We are definitely going to be promoting frequent hand washing. That's one of the key preventative measures in spreading COVID. Many of our classrooms have sinks in them, so the ability for students to wash hands is pretty high. And even when there isn't a sink in the classroom, we're going to be promoting that and creating opportunities for kids to wash their hands frequently. In addition to frequent hand washing, we're also going to have hand sanitizing stations throughout each building. So the opportunity to sort of get a squirt of hand sanitizer and rub that in as you're passing by in a hallway or through a door is also going to be there. We're going to have signs posted to reinforce hygiene, and we're going to be sanitizing spaces twice a day. So this is going to be sort of an all hands on deck effort to make sure that those spaces get sanitized twice per day. And bathrooms are going to be getting sanitized more frequently, just given the nature of the use of bathrooms and the frequency with which that the students will be there. But really a lot of effort from a lot of people to make sure that we're cleaning our spaces very regularly to help keep everyone safe and healthy. So again, from a physical health perspective, looking at transportation and what it's like to be entering school buildings upon arrival. So even before students have gotten on a bus or arrive at school, we're asking that families do a daily health screening before they leave. And we're asking staff to do a daily health screening before they leave the house. The best thing is to try and catch something before you've left the house. So that screening will involve some questions, taking a temperature, and anyone who doesn't pass that screening should stay home. So before they get on the bus, before they walk through a school building door, it's best to catch those, and anyone who's not feeling well should stay home. Really important. So it's really, really important that we not practice reducing a fever with medicine to be able to send a student to school. That just puts too many people at risk, including that student, but also obviously potentially many, many others during a global pandemic. So I'm hoping that everyone will be sure to not practice that. Important to note that buses will be operating. We are going to be offering that transportation mode. It's really important that we do our part to make sure that students can get to school. We want them to get to school as safely as they can. And there are no restrictions on the capacity for our buses. They can run at their full capacity, and we will distance students as much as possible. But that is the regulation, and that's what we're moving forward with, just to make sure that we can provide a means of transportation for students to get to school. Facial coverings are going to be required on the bus, and students are going to have assigned seats. So we're putting those measures in place, and we are really encouraging those who can to transport their kids to school, or have your kids ride their bike or walk, whatever they can do safely that doesn't put them on the bus, just to help keep the bus numbers down so that we can space those kids that are on the bus out as much as possible and help keep everyone safe. So continuing now, assuming they've arrived at school, the daily temperature is going to be taken for everyone as they get to school. So students, staff, everyone's going to have their temperature taken daily, so that's just sort of a safety check on our part as a school system to do our part and have sort of an efficient screening process to try and help keep everyone safe. We are going to have students entering buildings through multiple doors. So typically there's a small number, maybe even just one door that everyone who arrives, whether they're walking or getting dropped off or taking the bus, would go through. We're going to really be working to utilize as many entrances to our buildings as possible to avoid the bottleneck and the groups of people congregating in any particular spaces. And this will also help expedite the temperature taking process. And it is also really important. We're going to put a lot of effort into keeping cohorts of students together as much as possible. So trying to mix groups of students in as limited a capacity as we can, knowing that that's probably easier at the elementary level than it is the secondary level, just with the nature of the courses and the schedule and how it works at the secondary level. But you may hear your students talking about when they get home about not seeing other kids, and that's all probably true, because this is another measure to help limit the spread of COVID. This also is really helpful when we're working with the Department of Health, should someone test positive, to be able to track who's where and who they were with, and be able to help with that tracking, contact tracing. So again, with physical health, now looking at classrooms and personal items, students are going to be distanced as much as possible in the classroom. So the reason we're opening in a hybrid is because with half of our students back, that leaves plenty of room for students to be spaced out in their classrooms. So we're going to take full advantage of that. We're looking at, pretty typical classroom might have 8 to 10 students in it in our hybrid model. So that, again, we have the luxury of some big classrooms, in particular at our elementary schools, and that gives us the ability to space kids out really nicely and keep everyone safe. In addition, when possible, we're going to have desks and tables facing the same direction. Again, just thinking about the primary way that COVID is spread is through droplets in the air. And if we can keep kids distanced and not having them face one another, that's the sort of best case scenario to prevent those droplets from spreading. And again, the masks are key in reducing those droplets. We are also going to be putting some plans in place, and teachers will be building their plans to minimize student contact. So, we've been strong proponents of a lot of group work in years past. For obvious reasons, that group work is problematic now, at least in terms of having students work closely in proximity to one another. But teachers will get creative and do some amazing things to create opportunities for group work that doesn't bring students really close together and run the risk of spreading COVID. So same with sharing materials, like really just thinking very carefully about ways we can minimize the spread. For that reason, we're going to be really restricting borrowing items from one another and definitely encouraging the use of reusable water bottles. Recess. So that's a very important aspect of an elementary student's day. So important to know what that's going to look like. So face coverings are not required at recess if distancing is possible. Again, that goes with the idea of if it's outside and you can maintain distancing, that's a time when maybe the facial coverings are not needed. If distancing is not possible, then the mask will need to be on outside. And as we said, even though if they're going out for recess and students don't think they're going to need their face coverings, they should bring them with them just in case things don't go quite as planned at recess. We are hoping to be able to use the playground equipment, provided we can sort of put some final details together for a plan to disinfect that equipment. We need to be able to disinfect that equipment probably a couple of times a day at least to be sure that it's safe for use. I feel optimistic that we'll figure that out. And that will be a great bonus for students to be able to use that equipment during their recess time. Obviously, we'll put some practices in place in terms of keeping distance while they might be waiting in line for something. All those same precautions will be in place outside during recess time. And back to the hand washing, we're going to encourage kids to wash their hands before they go out to recess and after they come back in from recess. So visitors to the building. So again, in terms of trying to really minimize the spread of this and keep our students safe and allow us to continue to operate our schools, we are going to be dramatically limiting access to our buildings in general. So very, very limited access to visitors. We're not going to be, unfortunately, welcoming in volunteers. Family meetings even are going to be virtual as much as possible. There may be a few exceptions to that, in which case we're going to have a particular place where those meetings will take place and we'll disinfect our way in and disinfect our way out. But really trying to do as much virtually as we can, again, just to try and limit the number of people in our building at any one point, because we feel an obligation to know who's in the building, know who they were in contact with, so that should something happen and we need to work with the Department of Health to support their contact tracing, we can aid in that. Field trips are going to be allowed, but really only in the state of Vermont and only if it's a same day return. So any overnight trip, not going to happen for the foreseeable future. No out of state trips. And ideally we're targeting outdoor experiences where it's a little safer in terms of, again, the spread of COVID. In terms of access to our buildings, I've been a really strong proponent of the public being able to access our buildings for a variety of uses. I think our buildings get a lot of use, and I think that's a great thing. I think we all get a lot of bang for our buck when we can use these buildings as much as possible. And that's not going to be able to happen for a little while. So the public can use the outdoor spaces, the grounds. We do ask that they stay off the playground equipment because that only increases the chances of something being there for our students the next day. And unfortunately, until further notice, we cannot use interior spaces of our school. Again, we just need to really limit access to the building to ensure that it's the safest space that it can be for educating our students. So staying with physical health, when someone's sick, so again, first and foremost, anyone who's showing any signs or symptoms or is feeling ill should stay home. That's the best defense, is to not even have them show up at school. Anyone who is symptomatic at school needs to report to the nurse immediately. And so if it's suspected that someone may be symptomatic of COVID, they're going to be going to an isolation room just so that they can have their space, and others who may need other care in the nurse's office don't need to be in close proximity to those who are symptomatic. Doesn't mean they're positive, doesn't mean anything other than they're symptomatic and they're probably waiting for a ride to get home, and have someone sort of pay attention to their symptoms and determine if they need to get tested or not. Anyone who has been tested and is waiting for the response, They should not come to school until they receive a negative test result or have fully recovered if they do test positive. So we wouldn't want someone who has gone and been tested and is waiting a couple of days for their test to return to school. They should stay home until they get a negative test result or have recovered. If someone does test positive, anyone who tests positive needs to stay home, obviously. And MAUSD is going to support the Department of Health in their contact tracing. So the Department of Health has been doing a great job with this. And this is a really, really key point in helping to control the spread of this virus. So we will be paying close attention to who's in our building, the groups of kids who they're with, when they're with them, so that when the Department of Health calls and they need help in figuring out who was in close contact, and really important to know what close contact means. The definition for close contact is closer than 6 feet for more than 15 minutes. That's a really small number of people. If you think about the number of people throughout your day that you are closer to than 6 feet for more than 15 minutes, it's a very small number of people. Nevertheless, we're gonna have information that says effectively who was in contact with anyone that day, so that we can do our part to support the Department of Health. If someone is in close contact with someone who has tested positive, so this isn't someone who we think is going to test positive, it's also not being in contact with someone who was in contact with someone who tested positive. This is if you're in close contact, again, closer than 6 feet for more than 15 minutes, with someone who has tested positive, then you may need to self-isolate at home for 14 days before returning to school. And lastly, depending on what happens with the spread of COVID, I feel really optimistic about Vermont's numbers. I feel optimistic about our plan and the safety procedures we're going to have in place. And nevertheless, if there is an outbreak and a decision has to be made to close schools, that decision is the decision of the superintendent. Now, obviously, I'm not a medical expert. I'll be in very close consultation with the Department of Health. They'll be giving me some really helpful information to make an informed decision about what we do with our schools. But ultimately, the decision to stay open or close a school or schools rests with me as superintendent. In the event that someone does need to quarantine, if it's a student, and if they're quarantining because let's say they were in close contact with someone who tested positive, but they're not necessarily symptomatic, we hope that they're going to be able to continue to access their learning remotely. And those days won't need to count as absences. So if I'm quarantining for 14 days, take out 4 days for the weekends, let's say it's 10 days of school that I'm in quarantine, and I've been feeling fine, I have access to my computer, and I can do my remote learning, those are student contact days, which is great for the students' learning, and it avoids any issues with not being in school and not having those attendance days. As a school system, we need to make sure that at least 51% of our students are in attendance each day for that day to count as a student contact day. So we'll be paying attention to student attendance. If a classroom or more than one classroom needs to quarantine due to a positive test, those impacted students are going to continue to access their learning remotely during the quarantine period as well. If they're physically able to participate, those days are not going to be counted as absences. So whether it's an individual or a whole classroom or wing, if they can access their learning remotely, those count as student contact days. So shifting now away from the physical health of everyone, we're going to talk about the social, emotional, and mental health. As I mentioned before, this is a really key factor for us. We know that this is going to be a need for many, and we're going to be on top of it and making sure that we take care of this need. Early on in all of our schools, special attention is going to be given to building that sense of community. Again, students have been away from school, oftentimes away from their friends, potentially really, really isolated during this time, at least physically. We all know they have their devices in their hands and they're staying connected that way. But this is bringing students back in person is something that's probably different than what they've experienced for several months now. And we need to give that a lot of attention and make sure that they feel welcome and they're part of this community and are feeling comfortable with what we're doing and how we're reopening. Our school counselors are going to be meeting individually with each student multiple times throughout the year. That's kindergarten through 12th grade. And we have a screening tool that we'll be using with students and families that we're going to apply multiple times throughout the year, just as a way to sort of check in with everyone, see how everyone's doing, and make sure that we're not missing a student who is in need of some support, or potentially a family that's in need of some support. And each student is going to have an MAUSD employee check in with them on a daily basis, even if they're learning remotely. So we feel like that's a really important aspect of our plan, that we're in touch with kids even on the days they're not physically present in school. So as we think about staff needs, we want to make sure that we're paying attention to staff needs as well, right? So we need to make sure that staff are socially, emotionally, and mentally well, so that they can help take care of the social, emotional, and mental health needs of our students. So we're devoting 3 days during our pre-service to the well-being of staff, but also training for staff to support students with their social, emotional, and mental health needs. So really devoting a lot of time. And for reference, 3 days of in-service is more than what we usually have for professional development in a usual year for our entire pre-service days. So it's a significant amount of time. And I feel really good that we're going to be able to dedicate that amount of time to this need. All professional staff are also going to be setting at least one professional goal related to social, emotional, and mental well-being. So their development, their self-care, and their development of their skills to support students will hopefully continue to grow as we progress through our reopening and well into the school year. Efforts are also going to be made to ensure that meetings are regularly utilizing time for reflection and connecting with others. Again, because so many of the needs that our students have coming back and creating a sense of community are needs that exist with our staff as well. And we need that sense of community to exist amongst our staff members. And we need to create opportunities for that to happen. And we're going to be paying attention to those. I put childcare under the social, emotional, and mental health. As I think about working families, trying to figure out how to make this all work in a hybrid model, I think that puts a lot of social, emotional, and mental health stress on a family. So I'm really, really happy to say that we do have childcare in place for all 5 of our elementary schools. We're going to have 3 options for parents to choose from. There's going to be a workday option from 7:30 to 5:30. School day option from 7:45 to 3, and an after school option from 3 to 5:30. So we do unfortunately need to charge a fee for that. This is following the typical fee structure for our ELP programming that we've had in the past. So for those choosing the workday schedule is really a combination of the school day and the after school. So its total is $36. If it's just the workday option, which students can ride the bus to school and ride the bus home from school, for that workday option, that's $20. And if it's just the after school option, it's $16. So again, transportation to school for the workday and the school day options, they can ride the bus if that's something that works for your family. And certainly after school, if they're leaving at 3 o'clock, they can get on the bus and catch the ride home. Obviously, if they're staying till 5:30, then there'll need to be arrangements made by each family to pick those students up. Our childcare program is going to be run by our ELP staff. And I feel really great about that because the ELP staff really rose to the occasion when we needed to open up our essential persons childcare. They did a remarkable job in getting that up and running really rapidly. They had great success with that. Kids had a blast. Everyone was safe. And it was a really great environment. Likewise, our ELP summer program had a great turnout. A lot of students participated. We had as many students as 100 students each day here at Mount Abe. Again, kids had a blast. The staff were great. Staff, I think, maybe had more fun than the students even. And everyone was safe. So a lot of really strong practices in place from those experiences. We've actually benefited tremendously as we've been building our K-12 programming to lean on what they learned through their essential persons childcare and the summer programming. And they're really ready to rock this childcare option that we're going to have in place for our families. And if the fees are challenging for your family, please reach out. Our ELP staff will be connecting with you and they can help connect you to some state level financial support. And we do have some limited local scholarships that we may be able to offer as well. We do ask though that registrations get in by this coming Friday, August 21st, so that we can really pin down some numbers and put the final plans in place to make sure we're ready to go. So let's shift to continuity of learning. So this is priority number 3 now. And I want to talk about the instructional options that we're offering. So we've been talking a lot about the hybrid model, and that's a mixture of in-person and remote learning. That's how we're opening our schools. So that's going to be, some students are going to be in on Monday and Tuesday. So that's about half of our students. The other half of our students are going to be in on Thursdays and Fridays, and that's going to leave Wednesday when everyone's remote. So if I'm the student that's in Monday and Tuesday, I'm going to be in my remote learning Wednesday, Thursday, Friday. Likewise, if I'm a Thursday, Friday student, then I'm going to be in my remote learning Monday, Tuesday, Wednesday. All students are going to be remote on Wednesdays. We need those days to make sure that we're doing a deeper clean of the buildings. It's an opportunity for teachers to check in with students. It's an opportunity for teachers to connect with other teachers, have some planning time, and just make sure that we can do this really well. You know, it's pretty tricky to simultaneously be providing in-person instruction to those students that are sitting in front of you in your class and remote opportunities to students that are not physically sitting in your class. So we want to make sure that we can do that well, and it's going to take some time and support to do that. And again, MAUSD staff are going to be checking in daily with those remote learners. Just to have that connection. We have the benefit of, for most students, to have the 2 in-person days. So it'll be easier to sort of extend that learning into Wednesday, Thursday, Friday, or whichever the other 3 days are that they're not physically in person. But we still want to make sure that we're checking in daily and making sure that we're attending to needs that our students have. And because we have limited in-person time, we are going to make sure that we're focusing on core academics during that in-person time. That's really precious time. It's always precious time. It's especially precious when we have 2 days of in-person instruction. So we're going to really make sure that time is focused on our core academics. So the other option is the fully remote option. So in the fully remote option, that means there's no in-person instruction from MAUSD staff. Elementary students will be supported exclusively by MAUSD staff. There are some districts that are offering some other remote options. We've decided to keep it in-house. We feel really good about our curriculum. We feel good about our staff and our ability to make sure that we're staying connected with kids who are remote only. For our secondary students, it's going to be a blend. There will be some support from MAUSD staff directly, but we also have a couple of different options that have worked well in the past at the secondary level for some remote options or some virtual options, such as the Virtual High School and the Vermont Virtual Learning Collaborative. So sort of a combination more so at the secondary level of options for students in terms of what supports they may have. As we think about student services, so case managers for students on IEPs are going to be contacting families before school starts just to reach out to see sort of what's the plan that family has chosen. Are they going to be hybrid? Are they going to be all remote? And what supports does the family need to ensure success for their child? So that close contact with families and that work ahead of time is going to pay dividends in making sure that we have the right supports in place for students. So no exceptions here. Students are going to be required to wear masks unless the documentation is proven by a physician that it poses a health risk. So again, that's going to be a plan that's in place that's been developed by a physician. And there's been some communication with school staff, most likely including the school nurse. And it's really clear why a face covering or a mask can't be used. And then there's some conversation around, if no mask, then what other precautions can we make sure we have in place? Shields, plexiglass barriers, there's some other options that we'll explore. Those will be on a case-by-case basis. And adapted face coverings, assistive technology, other supports, but basically whatever we need or whatever is decided by the IEP team to have in place to keep everyone safe and healthy, priority number 1, and ensure that we can provide the supports that students need to be successful, priority number 3. Early education. So we do offer some early education in MAUSD, an MAUSD run program. That program, which is housed at Bristol Elementary School, will run with a similar schedule to the K-12 programming. So there's a Monday, Tuesday group of students and a Thursday, Friday group of students. However, their days are going to be shorter, running from 8 to noon. And I believe that's already been communicated with families that are in the early education program. And remote activities are going to be provided on Wednesdays. All of the same health and safety practices as the K-12 will be expected. And those children in private settings who receive services from MAUSD are going to have options for continued services. So we still want to work with families to make sure that those students are having their needs met as well. So again, more communication will be coming out specifically to those families to talk about what kinds of supports will be helpful. And I do want to talk just briefly about school calendar. I have this under continuity of learning. I think it fits with sort of the idea of when we're in attendance and when we're not. So we, as you all know, September 8th is the first day of school. And originally that was planned for August, might have been 26th, I think. So there are a number of days that we were expecting to have student days that are now going to be in service and training days for staff, which is great in terms of preparing for the reopening of schools. However, it's unclear right now what the 5 days basically, at least for us it was 5 days, what's going to happen with that. It requires legislative action to reduce the required number of student contact days from 175 to 170. We're optimistic that that action's going to be taken, but we won't know yet until the legislature resumes and takes this issue up and takes whatever action it is they're going to take on the number of required student contact days. Assuming there is action to reduce the 175 to 170, September 8th, regardless, is going to be our start date. But currently we're anticipating a June 11 end date. So that obviously, if the legislature doesn't act to reduce the number of required days, that could change. If we have snow days, that could change, etc. There are a couple of other changes that I think are important for folks to know. Again, I can't really put out a finalized new draft of our calendar until this legislative action happens, because there's some unknowns still. But as we've had to shift some of our in-service days to the front of the year, that means that some days later in the year that were planned to be in-service days now won't be. A couple of those days happened during the week of Thanksgiving. So already for students, they were not anticipating being in school for the entire week of Thanksgiving, but now students and staff won't be expected to be, and this is really school year staff, won't be expected to be in school for the entire week of Thanksgiving. So the Monday and Tuesday of Thanksgiving week were originally in-service days. We moved those to the front of the year. Now those are not in-service days. Those are days off. March 26th also was scheduled as an in-service day. Again, we moved that March 26th date in addition to the 2 days during the week of Thanksgiving, all up to the front of the year to try and make sure we had that time and cover those days. So March 26th was an in-service day, which is a day that teachers would be expected to be at work and we'd have professional development, and students were not expecting to be at school. But now March 26th will be a student day. So we will be looking for students to be in school on March 26th. So again, once the legislature takes action on the number of student days, we can finalize this calendar and we'll distribute that out really widely so that everyone knows ahead of time. But I thought those were two pieces of information that might have an impact on families and staff. I wanted to get that out there. So that's the end of my presentation. At this point, I think I'll turn it over to Krista for the Q&A portion of tonight. Not sure about everyone else, Krista, but I can't hear you.
Yeah, I can't either.
How's that now?
That's better.
Okay. I was cutting in and out before, but is it pretty clear now?
Yeah, it sounds good.
Okay, great. Sorry about that. So what I was saying earlier is if you're joining us a little bit late, you can see the Q&A button at the bottom where you can pose your questions. We have until about 8:30. So if we don't get to your question, you can submit it to our email address, covid.help@mausd.org. So our first question is, if our child starts out full-time remote learning, can they switch to in-school learning if those guidelines change? And conversely, if my child starts with in-school learning, can they switch back to full-time remote if the restrictions are not working for them?
Yes, is the answer to both of those questions. So it doesn't much matter in terms of what the guidelines are. It's really about a family's comfort level with what we're offering. You know, if a family is not comfortable with their child being physically in person 2 days a week, then they can choose that remote option. And at any point in time, if that remote option either isn't working or if they grow more comfortable with what's happening with the hybrid, they can have their student start attending 2 days. They'll need to be in communication with their building principal, because which 2 days the student comes in may have an impact. So we'll want to be, thoughtful about that. But absolutely, we want to be flexible and attend to families' needs, because needs change, and we just want to make sure that we're supporting whatever those needs might be.
Okay, great, thank you. All right, so our next question is about health screenings. So what are the specific health screenings we should engage in before sending our students to school? For example, what temperature is considered a fever?
So there will be two components to the health screening. One will be a series of questions, and we need to really kind of finalize what that series of questions will be, and then we'll send out to families what questions we're asking families to ask of their children. So we'll help with that. The other is the temperature taking. So the information that we've received is a temperature 100.4 or greater is the temperature at which a person, child, adult, whomever, should stay home. And again, we don't want anyone, giving their child Tylenol or something to mitigate that temperature or that fever and sending them in. They need to be fever-free without medicine 24 hours before they should come in.
Okay, great, thank you. Our next question is whether there will be an orientation school day for 7th and 9th graders where they start the day or have a half day before everyone else, as has been the tradition in the past.
Yeah, I know that's been a topic of conversation and a lot of work going into figuring out how to do that. It's very, very clearly recognized as a need. I know there's sort of a kindergarten orientation effort happening right now to try and think about how do they do that safely, but also thinking about 7th and 9th graders who are making a transition and needing some orientation. A lot of thought going into how to do that. For some of those details, I'll turn it over to Shannon and perhaps Justin and maybe even April, but I'll turn it over to Shannon, then she can turn it over to whoever she wants.
I'll take the first one. So we recognize that this is a need, and at the same time, there's also a need for all the kids that are coming back since nobody has been here since March. So our plan is, since we'll only have half of the kids here at a time, is on each group's first day, so on that Tuesday and then on that Thursday, to really extend our advisory time to include an orientation or a reorienting time for all students, regardless of their grade. And that would be a time to get acclimated with the new directions that the hallways are going to go for traffic flow, the safety procedures and protocols that are going to be in place, learning how to read your schedule, how does all of that work, how's lunch going to work, answering those questions and that sort of thing, so that kids have a longer amount of time with a small group of peers and one teacher that they'll be working with all year, 2 times a day for advisory and for fit block.
Great, thank you. Okay, our next question is about riding the bus. If a child rides one bus in the morning, will they be able to ride a different bus in the evening?
Yeah, it's a great question. So when we sort of think of steps, right? So the state of Vermont is opening at step 2, which has a series of recommendations that come along with that, except for bus transportation. So bus transportation is opening at step 3, which is a little more sort of loosely regulated or has looser recommendations. So I don't see any reason why that wouldn't be possible. Again, we'll want to know ahead of time so that we know who's on the bus, we know what the numbers are going to be on the bus, we can keep students spaced out, and we can make sure that there's an assigned seat. So all of those same precautions that we're going to have in place on the way home, we want to make sure we have on the way back, or sorry, that we have on the way to school, we want to make sure we have in place on the way back home.
Okay, great, thank you. All right, our next question, how will the ventilation systems be upgraded, cleaned, maintained to prevent the virus from recirculating through the air?
Sure, I can talk a little bit about this. So we're very fortunate in that within the last, I would say 2 or 3 years, all of our elementary schools have had their HVAC systems cleaned. They've all had sort of updated maintenance schedules. Their routines have gotten really in pretty good shape. That was a direct result of working closely with a sort of citizen HVAC group a couple of years ago. So in our elementary schools, they're in really tip-top shape. Mount Abe, there was some question about the lifespan of the system when we were assessing that, so we didn't invest in cleaning the ductwork that we thought maybe we were going to have to get rid of at some point. The system tested far better than anticipated, and efforts have been underway to get the ductwork at Mount Abe cleaned. It hasn't yet been done. We're still working on that. It likely won't be done before school starts, but it will likely be in progress when school starts, and it will sort of be phased in as there are vacations, and as time allows, workers are going to be coming in and sort of chipping away at the duct cleaning. So that's the cleaning aspect of it. Our systems are running much more efficiently because of the routine maintenance that's been happening. So they're running better than they have for a long, long time, which is great. Again, really good timing. That's all stuff that we had in place before COVID hit. And in addition, since COVID, we have invested in a much, much higher grade filter. So the filtration that's happening within the air handling units is much greater. So all of those things are in place. We're still trying to figure out the right rate of circulation at different times of the day. So one theory is we should have the air circulating as rapidly as possible, because that increased air exchange rate is going to pull a lot of the sort of contaminants out of the air that much more frequently. However, most of our air handling units pull air in from sort of the rooftop area. On a really hot day, say 90 degrees, when you're pulling in what might be air temperatures over 100 into the building, that can create problems. So our buildings, for the most part, are not air conditioned. You know, it's one thing in the winter, we can really crank up the air exchange rate because we can condition cold air and make it warm. We're not well equipped to condition warm air and make it cool. So we're still trying to figure out exactly what that plan is and what the right exchange rate is. But it's really not going to be because our systems aren't functioning properly. It's going to be about what's the best advice on how to walk that line.
Okay, thank you. All right, this next question is about recess. So will more staff be outside with kids during recess? And will there be more structured play introduced for recess time?
So we don't really have the answers to that yet. Those are some of the things we're thinking about. You know, I think it's a genuine question. Will we need more staff at recess? Maybe. And I think the idea of some structured activities makes a lot of sense, so we can help students engage in play that maintain some of the practices that we want to use to keep everyone safe. But we don't have concrete decisions on a district level on either of those fronts just yet.
Okay, thank you. Will there be required testing for students, staff, and faculty before the start of school?
So I'm assuming COVID testing is what we're talking about, and the answer is no. There will not be required testing for students, staff, or faculty.
Okay, with regard to visitors in the buildings, is there a plan for district-wide teachers, teachers that might in the past have traveled to other buildings to teach?
Yeah, so that is absolutely something we're giving some thought to and trying to minimize the number of adults that are in multiple buildings. We get a lot of discussion around that. I'm not sure that we've necessarily landed anywhere. I'll turn it over to Katrina, who's been working on that a bit, to see kind of where we are in the process.
Well, actually, Susan and I both have been thinking a lot about special educators, for example, and interventionists. I've been thinking a lot about instructional coaches, really trying to think about how can we continue to do our best work and yet minimize how many people are accessing buildings and learning spaces. We're still in the process of figuring all of that out in terms of which kids really were actually thriving during remote intervention in the spring. We have a handful of reports from our special educators and interventionists that it was actually successful. So if we can have some of those staff working remotely and providing intervention that way, that could minimize how many times they're actually entering a classroom or kids are going into a different space. We're looking into a lot of instructional coaching ideas that can happen remotely for teachers as well. So we're trying to minimize it as best we can, but we haven't come up with some firm plans yet. We're waiting until we have our people back to have those conversations. But Susan, do you want to add more?
Yeah, the only thing I would add is that, you know, throughout the remote period in the spring, we held a lot of meetings with families as well. So that minimized our, as we think about going into the fall semester, our ability to continue those remote meetings is something we'd like to talk through. And we found that in a lot of cases, it was really helpful for families because they're busy and they're working. And so they didn't have to leave work necessarily to come to a meeting. They could participate on a cell phone or a laptop.
Okay, great, thank you. All right, the next question, will elementary schools have a full-time nurse on staff this year if they did not in the past? If not, will there be a designated person covering for the nurse? And what kind of training will staff have to ensure safety for our students, COVID and non-COVID related?
So the answer is no, we won't have a full-time nurse in each of our buildings. Some of our buildings have never had a full-time nurse, so that isn't changing. We have, and again, this predates COVID, for the last year or two, we've had a structure in place for nurse delegates. So in recognition of the fact that some of our smaller elementary schools don't have a full-time nurse, we have identified individuals in the building that are nurse delegates that receive training. So they get training from the school nurse. They may get additional training from folks that are CPR certified to provide training, et cetera. So we're going to continue to lean on that system to be sure that we have designated people in our buildings to help respond to all things sort of nursing related, including COVID, but all the usual things as well.
Okay, thank you. With, if anyone is not feeling well and stays home, how are you planning on staffing those positions? Do we have enough subs? Do we have extra custodial staff if they get sick?
There's the million-dollar question, right? So we didn't have enough subs pre-COVID for to meet sort of the needs when folks had to be out. And we are seeing pretty clearly that we have fewer subs during COVID than we had before. When we couple that with the increased potential for absenteeism due to quarantining and all things COVID, that does create some concern. We are working to build, in particular at the K-6 level, a little different structures at 7-12, but building what we're calling kind of a buddy system, so that in the event someone is out, they have a buddy that's been in their classroom that knows the instruction, knows the students. This buddy will help when both are healthy and present. This buddy helps manage the students that are learning remotely, and may even sort of cover for the classroom teacher for the in-person instruction, so the classroom teacher can check in with students remotely. So there's a very symbiotic relationship between these buddy teachers. That system's going to help us if one of those buddy teachers becomes ill and has to be out. In the event we can get a sub, that would be great. And then the buddy teacher who's still at work can support the substitute and vice versa to make things work. And in the event we can't get a substitute, we still have someone there that knows the students, knows sort of what's been happening instructionally, and can help meet that need. So we're trying to build our internal capacity to cover for one another in the event that there isn't a sub to cover, because I think that's unfortunately going to be our reality.
Thank you. And that same question was posed about custodial staff.
Sure. So we do have some custodial substitutes, and we'll be leaning on those. We feel better about the number of custodial substitutes that we have, and it may still be insufficient, in which case we will piece together what we have to piece together to be sure that, again, thinking about our priorities, the disinfecting and that kind of cleaning happens regardless of how many people we have. That has to happen before anything else. If a floor doesn't get vacuumed because we had to disinfect, then a floor doesn't get vacuumed. Disinfecting takes priority. So we're having those conversations, and we're planning for that possible reality of not having enough people.
Okay, the next question, can you talk about the expectations for the days kids are home doing remote learning?
Sure, I think, again, some of the details of that are still being developed. The expectation is that they're engaged in their learning. I think the number of minutes or hours that they're on screen is something we're still trying to figure out. We're very sensitive to, like, we obviously don't want students sitting in front of a computer for 6 or 7 hours on their remote days. That's not at all what we're going for. But exactly how much of it's going to be sort of virtual learning on the screen versus some project-based work that they might be doing with materials at home, those are still being developed, but I can turn that over to Katrina as well to see if there's any details to add.
Patrick had mentioned earlier that 3 of our 12 pre-service days are being devoted to social emotional learning and mental health, not only for students, but for us as adults. We have 5 days, the equivalent of 5 days that we're devoting to continuity of learning for K-6 teachers and 7-12 professional and educational assistant staff. So we're spending a lot of time putting those agendas together to make sure that we've got collaborative time so that folks can really start putting their heads together with the tools that we have. When they actually know the kids that they're going to have in person on which days. There are some classes that have as many as 4 kids who are going to be 100% remote learners and some who have none. So there's a lot of range in the kinds of different types of planning that we're going to be helping people to do. We've got a great instructional support team, K-12, working real hard to make sure that whatever support folks need through technology, recording lessons, making sure that they have support in terms of putting printed materials together. So as Patrick said, there's a balance for kids so that it's not just sitting in front of a computer the entire time that you're not at school. Much more to work through together.
Okay, thank you. All right, the next question, where will childcare take place?
So childcare is going to happen in each of our 5 elementary schools. I don't know that exactly which classroom in each of those buildings or classrooms, if it's Bristol, it will necessarily be happening in, but we know that there will be childcare in each of those locations. I don't know if Mandy has any more details on that. I suspect they're still developing though.
Yes, they're still developing, but we'll have a wonderful space in each of the schools for the program.
Okay, great, thank you. Another question related to that, can students do ELP different days each week to accommodate changing parental schedules?
I think I know the answer, but I'll let Mandy lead this.
Yeah, I think that's a great question. And I think it's an important question because the world has kind of been swept from under us and all of our schedules are, we're kind of faced at a crossroads. So, you know, what we're doing right now is we're building a program according to the needs in our communities and at each of our schools. And the work is that we're hiring the staff to fit the needs for each school. It's going to be a little bit tricky to have, you know, a variety of numbers each week that may really look different from week to week. We really need to make sure that we are following all the guidelines and all the safety protocols, and that's always kind of our first and most important work that we're accomplishing right now. So we have certain pod numbers, we have spaces that are designated for certain numbers of students. And so, you know, what we suggest and what we recommend is, just like in years past, you can reserve that spot for your child, pay for those days that your child's not attending. We reserve that space, and we'll see your child every other week. And we'll work case by case, you know, as we go through this, understanding that we're all in unique situations.
And another question that might be for you, Mandy. If you don't anticipate needing ELP childcare until sometime later in the school year, should you register? Do you need to register now?
Take it away, Mandy.
Okay. The registration right now that is due on Friday, and I want to emphasize that again, just like you did, Patrick, that the due date for registration for the hybrid school schedule is due on Friday. That registration is for the hybrid school schedule. So understanding that guidance may shift and the scientific data may shift, we may be offering different types of programming, and at any of those junctures, new registration paperwork will be forthcoming.
Okay, thank you. All right, this is a question about masks. Can kids wear a gator style mask if it's at least 2 layers?
I may kick this to Justin. My understanding is 2 layers of gator style mask is not ideal, but acceptable. Single layer gator is, some would argue, worse than no mask at all. Justin, I don't know if you want to add to that or correct me.
Yeah, no, that is correct. So I reached out to Brina Holmes, who's the state of Vermont. She's on the recovery team for the state of Vermont for school reopening, for the safe and healthy start of schools. And she definitely said gaiters that are 1-ply are not acceptable for schools, and schools should give students alternative masks if that's what they arrive in. If they double them, they're fine. The problem with the gaiters is that they're made of usually a spandex type material, and it gets saturated very quickly, and then the efficacy of the mask is done once it's wet. And so if teachers or staff notice that the child's mask is wet, they're going to be asked to change it. And so that's really the problem with the gaiters. It's not, they need double ply, that's first and foremost. And second, it's that they get wet much quicker than the cloth mask does.
Okay, thank you. What are the expectations of students on their remote learning days? We asked a little bit about this earlier, but this is about needing to be on Zoom at specific times during the day. So if students are at a childcare and they are not available at a particular time, what would that look like?
So this may be something that's specific classroom to classroom. I don't know that there's going to be a district expectation for a schedule for a live Zoom session. Katrina, correct me if I'm wrong or add any details to that.
No, it'll have to be figured out on a case-by-case or class-by-class basis. We certainly don't want any child to feel penalized because they don't have access or they aren't able to, get on Zoom at any particular time. So we would definitely want to make sure classroom teachers were supported in understanding their students' individual schedules and what it is that they're able to do or not able to do, so that we made sure that we responded to the lowest common denominator, right? So if not everybody can do it, then let's try something different. But I would never want anybody to feel stressed because they're unable to access a computer, for example, on a Thursday at 8:30.
At the risk of putting in a shameless plug, if they're in an MAUSD childcare setting, they'll have access to Wi-Fi devices, and we can help facilitate that experience in our childcare setting.
Okay, thank you. The next question, as a classroom teacher of elementary students, I'm concerned about teaching 3 different groups of students within 1 week, Group A, Group B, and remote learners at home. Is there a plan to hire or assign other staff members to work with the remote learners who are at home?
So there isn't a plan to hire additional staff to make that work. But again, as I was talking about the buddy system, we're going to be leaning on that buddy system to help make that feasible. That is absolutely something that a lot of thought has been given to. It's a valid concern to think about how do we juggle all of that need. And we feel like the buddy teacher system is a robust system to help meet that need. And as we work our plans and we understand more about the level of sort of efficiency and effectiveness that they bring, we're going to make adjustments. This is fairly uncharted territory here, and we have, I think, a good plan. And I know we're going to have to adjust once everyone's back, and we're needing to figure out how to make it all really happen.
Okay, thank you. So in reference to breaks and wearing masks, you mentioned earlier that students won't need to wear masks while they're eating, drinking, and if they're outside where they can be sure to social distance. Is there a plan in place or being discussed where students can have specific planned breaks for taking their mask off safely?
So that's another level of detail that I don't know that we'll get to on a district basis, but I think recognizing, so I think most teachers have recognized for a long time the importance of body breaks, et cetera. So those can create opportunities on a classroom basis to get outside, get some fresh air, keep the distancing, take the mask off for a minute, and then come back. And those can be even just 1 or 2 minute, run around the playground or something and back in the classroom kinds of activities. So I think teachers will certainly have the latitude to do that. And I think they'll take advantage of opportunities like that to give kids a chance to take the masks off, do it in a safe way, breathe freely, and then back to work with the mask on.
Okay, thank you. How many students are you predicting will be at Mount Abe on any given day?
Good question. So somewhere around 25, less than half. I don't know how many students that would be. So 300-ish?
It's less.
A little less than 300?
Yeah, it's about 286 right now, I think is the number.
Okay. 300 is pretty good in my assessment, I think, right there.
Okay, thank you. How will mask wearing in classrooms and hallways be enforced? Will there be some sort of teacher supervision?
Yeah, so that's sort of a tricky one too, and that's a case-by-case basis. It's going to be first and foremost, we're going to be working to educate. We want students to know the reason why the masks are important, and we want to help them understand that so that not only will they wear the mask when they're at school because they have to, but they'll wear the mask when they're out in the community, and the benefit of the mask applies the same in the grocery store as it does in school. So we want them to understand it beyond just the school context. Having said that, it's going to be really important that students are wearing their mask, and if there's something getting in their way, we want to work through with them what that is and try to overcome that. If it's flat out defiance, then we have our discipline system that will be enacted, and we'll go that route, because it is required that students wear a mask unless they have some sort of a plan drafted with their physician, and we are going to enforce that. But we're gonna take an education approach, much like the state of Vermont has in its application of the mask requirements. And that's really what we're here. Like our job is not to punish kids. Our job is to help educate kids, and that's going to be the approach we take with wearing masks as well.
Okay, thank you. Our next question, will teachers be encouraged and supported to use a school's outdoor spaces?
Absolutely. We have some beautiful outdoor spaces. Both, sort of more formalized outdoor classroom spaces, and those are great. And we encourage people to take advantage of them. And just in general, we have some beautiful outdoor space that can become, an outdoor learning kind of environment. So for sure, totally fine. Kids eating lunch outside, that can be a great thing rather than sitting in their classrooms. Educational opportunities outside. There are certain things that really will only be able to happen outside. Chorus comes to mind, right? So because again, how this is spread, singing inside in groups, not a very good idea, but singing outside with space in smaller groups, that can happen. So there are some things that are very much going to be encouraged to take place outside. Then we just cross our fingers that our fall weather is going to be conducive to that. We know there will at some point be weather that's less conducive, but we'll take advantage of it as much as we can.
Okay, thank you. Will you still have early release days this year, or are you going to make those days full days for students to optimize their in-school learning time?
Our plan right now is to still have early release days. Those happen to be scheduled on Wednesdays, and those are days that are already going to be remote days for students, at least for the foreseeable future. So our plan is right now to keep those remote or those early release days on Wednesday.
Okay, thank you. Who will be doing a deep clean on Saturday, Sunday? And will that also happen on Wednesdays? Or will there be extra staff hired? Will we be outsourcing to a cleaning crew? And what are the standards?
So at this point, we're not planning to hire additional staff. In fact, we've had some positions posted that we've been struggling to fill. I don't know that there are lots of people out there taking jobs that that we're looking to fill. So even if we made lots of efforts to hire more people, I'm not sure that we would have our needs met that way. So we're going to have to think about how to, again, utilize the resources we have to do what we need to do. That might mean some Saturday and Sunday, so that might be some shift scheduling. We typically have some Saturday and or Sunday time scheduled already, in particular at Mount Abe. That would be, I think, something new probably for most of our elementary schools, but we're going to have to assess that. And some of it depends on what does the building look like at the end of the day Friday, and what do we have for staff, and how can we piece that together. So we don't have exactly the details planned on that yet, but it's something we're working on. I don't know if you have any details to add on that front, Floyd.
No, I think you covered it pretty much. We're struggling, as are most of the districts, to find qualified people to fill roles that we currently have open.
And a secondary part of the question was around the standards that will be followed for cleaning.
Yeah, I don't have a lot of the specifics of what the standards are. I know, like, from a sort of procedural standard, we're expecting that the building is disinfected twice a day. We know most of our disinfectants work because they sit on the surface for a period of time. So sort of spraying it, letting it sit, wiping it down. There are certain standards in terms of what material we're using or what chemicals we're using and what level of sort of alcohol content they are and their effectiveness at taking care of the viruses. So I don't remember what the specific % alcohol the disinfectants needed to be, but I know that what we have meet those requirements. And then balancing that with the safest products we can use that get the job done.
Okay, thank you. Will our high school students also be required to eat in the classroom and not in the cafeteria?
Yes. So the plan right now is for all students to be eating in the classroom, or again, as we said, potentially outside with distance in all of our buildings.
Okay, thank you. All right, the next question. You discussed distancing in the classrooms, but you didn't talk yet about how that will be handled in hallways and restrooms. Can you talk about that a little bit?
So Shannon spoke a little bit about one idea, which is to have, certain directions, like so putting some signage on the floor, on the walls that indicate the flow of traffic that will help keep some of that distancing. Thinking about, and I'm sure and this is more so at the secondary level because students will be traveling in the halls more frequently at the secondary level, just because of the nature of the schedule. So maybe Justin or Shannon or April can talk more about thoughts on how to mitigate some of that at Mount Abe.
Go ahead, Justin.
We're both like, who's going to take it? Who's going to take it? So we're fortunate enough, we switched to what's called a 4x4 schedule. And with that switch, we have some faculty members that are able to help us with duties around the building, such as monitoring hallways, ensuring that the restrooms aren't overcrowded. So we will have people, there will be signage posted per the state of Vermont safe start to school guidelines all around the building, really helping us ensure that 6-foot distancing is being enforced with kids at Mount Abe.
And in terms of the bathrooms, I know, so again, a number of our classrooms at the elementary level have bathrooms in their classrooms, so that makes it a lot easier to manage the sort of spacing and the groupings there. I'm not sure of the details of plans on how to mitigate that for places where there are sort of multiple use bathrooms. Is that anything you've given thought to? Manib has more of those than other buildings.
The current thought around that is around the sanitization schedule. And so they're just going to be cleaned more frequently. Any multi-use bathrooms are going to be cleaned at a more frequent rate than those that are in the classrooms.
Okay, thank you. This next question, when will complete in-person learning be available?
Great question. We don't know. Really, because we're going to need to be adjusting to whatever happens with this virus. The numbers look really good right now. We feel really good about being able to reopen in a hybrid model. If the numbers stay really good as more and more schools reopen, then we're going to be able to take a look at the possibility of sort of phasing in more students. So the language in the guidance now allows kindergarten through 5th grade to be as close as 3 feet, which offers up some opportunity. We're going to have to see how is our planning working out? Have we worked out some of the logistical challenges? Do we feel like our practices are solidly in place? And then, assuming the numbers with the COVID are still solid, we can start talking about, do we bring in 1 grade at a time? Do we bring back all K through 5th grade? Like, we can start having some of those conversations. Optimistically, you know, maybe as soon as the early to middle of October, that's something we might be looking for, you know, to start thinking about bringing back more students for in-person instruction. It's just really hard to say for sure right now. I do anticipate being able to put out a notice here in the coming days, probably toward the end of the week, as we look at it a little more carefully to see, to try and give people a window in which we might think about doing that. I think it'll help people wrap their head around that possibility. It'll help people wrap their head around how long can we do what we're setting out to do in our hybrid reopening if we have at least a window of time in which we're going to reconsider what we're doing. So I hope to be able to put something out by the end of the week that speaks to that a little bit more clearly.
Okay, thank you. How will the current situation impact standardized tests this year?
It will have a significant impact. Our assessment schedule is going to look very, very different than what it has in years past. And I can let Katrina talk more about what's in the works around our assessment schedule.
In terms of our internal local assessment plan, some of the testing that we usually do at the beginning of the year in terms of screeners to check in with kids, we're definitely taking a slower approach to that. We really want to be able to meet kids where they are, do some formative assessment work, just to make sure that kids are feeling safe first, welcomed second, and then we'll start employing some screeners that are a little more gentle maybe than some of the assessments or tests that we've given in the past. In terms of standardized tests and at the state level, I honestly have not heard what the plan is for the spring normal testing schedule that we usually give in terms of the SBAC. So that is still yet to be determined as far as I know.
Okay, thank you. How will students be graded if they are doing 100% remote learning?
Katrina, do you want to speak to that one as well?
I will, but it's still yet to be talked about. When we have our teachers back, you know, the next couple of weeks, there'll be lots and lots of conversations about what that needs to look like. Teams need to calibrate together. Grade level teachers are going to be coming together. Departments are going to be coming together. So as long as we, like we talked about last spring, have identified critical proficiencies, what we definitely want kids to be able to know and be able to do, even if they are in a hybrid or remote learning environment, if we pare that down to the most critical things, then we can focus our energies to make sure that our kids are getting what they need. It'll look different, obviously, for sure, but together we're going to have to start climbing some of those mountains over the next couple of weeks.
And again, we have the benefit of a remote learning spring to understand more about what worked or didn't work during that time and apply that new learning to plans for reopening in a hybrid.
Okay, thank you. How will sick days affect truancy? If children are sick but well enough to participate in remote learning, will remote attendance count?
Yeah, so remote attendance counts. If a student is well enough to be present remotely and be doing the work expectations remotely, then that counts as a student contact day. That's an attendance day. And the reality is, sick days typically have not counted from a truancy perspective because there's a legitimate reason for the student to be out. But this remote option that we now have in place really provides an opportunity for students that maybe aren't well enough to be in school, but are well enough to be on the computer and be engaged to still be doing what's expected, and then not have what could feel like, something hanging over their head in terms of makeup work when they get back. So yeah, we would encourage students that can to do just that.
Okay, thank you. How will parents and the community be informed if there is a positive COVID test in the classroom or in one of our schools?
Yeah, so we have a responsibility as a school district to protect the privacy of individuals. So we won't be sharing information about someone tested positive. We are going to work closely with the Department of Health, to provide information about who was together on that day, et cetera. But the Department of Health will be doing their contact tracing. They will let the people who need to know that they were in close contact with someone who tested positive, and that's where that stops.
Okay, thank you. All right, the next question. Will children and staff have their temperatures checked partway through the day, since some illnesses don't really set in until the afternoon? How will we be notified, and would they be considered for having COVID?
So I can let Justin fill some of this in, but at this point, the plan is to check temperatures upon arrival. We don't have a plan to check everyone's temperature midday in addition to the arrival. Having said that, we're fortunate, especially with half of our students in our buildings and almost all of our staff still in the buildings, that we're going to have a lot of eyes on kids. And I think teachers get to know kids well enough to know when they're not feeling well. They might, see something that could be symptomatic. They might just, as parents often can, you can often tell when a student's not feeling well. So whether the student raises it themselves or a teacher notices something's a little off, that may be something that prompts a visit to the nurse's office where their temperature might be taken, and then steps can follow from there. But we're not planning to take everyone's temperature again midday. Anything to add to that, Justin?
No, all I can add is that the Public Health Committee has talked about if a student is elevated, if they have an elevated temperature but not a fever, that the nurses will be monitoring them or the delegate will be monitoring them throughout the day to ensure that they're not spiking a fever.
Yeah, and if they do have a fever above 100.4 or they're showing other symptoms of COVID, then they're going to be escorted to the isolation room where they're going to then be waiting for someone to come pick them up. And parents will be notified through the information we have in our computer systems about whatever their contact information is, to make sure that someone comes and picks them up. Which brings up a really good point in that we need to have really good information on hand. And have a really good sort of backup system for emergency contacts, so that should someone need to go home, that we're able to get in touch with someone who can then come and bring that child home. It's in everyone's best interest, that child and everyone else in the building, if we can get the child home sooner rather than later.
Okay, thank you. The next question, where can I find more information about the 100% remote option offerings? Where can I find more information about the virtual high school, the Vermont Learning Collaborative, and other resources?
So I'm working on a somewhat comprehensive report or plan document that outlines a lot of what we talked about here tonight and some other details about our plan to reopen. So that's one resource that will be coming out soon. Shannon, Justin, April, maybe I'll kick it to Shannon. Do you have a source that you can point people to learn about VTVLC or virtual high school?
Yeah, so both of those websites are really comprehensive in terms of what is offered and at what grade levels and what level the course is, if you're looking for an honors biology or an advanced placement biology, something along those lines. And the student school counselor is going to be a great resource in trying to figure out what's going to make the most sense for each student.
Okay,
and in
thank
general,
you.
I would just encourage folks, if they have if they have a particular question, maybe they're considering virtual high school or VTVLC, just send an email. It can be email me, email Shannon, email Justin, April, email whomever you can think to email with your question. And if they don't have the answer, they'll connect you with someone who can help you with that. So I don't want people to feel paralyzed in reaching out for help, because you can really reach out to anyone for help, and they'll help you get connected. And for that matter, use the covid.help@mausd.org for a question like that. And there are a number of people that are checking that regularly to try and answer those questions. So any way that you can think to reach out for help, feel free.
Okay, thank you. For Mount Abe students, if you're doing only 4 blocks per semester, how will half-year courses be held? How's that going to work?
Half-year courses will be completed in a quarter. And we're doing it that way to allow students to take as many of the courses that they signed up for last spring as possible.
Okay, great, thank you. Okay, will students who are doing fully remote learning have access to computers like they did in the spring?
Yes. And support for those computers, right? So the initial distribution of computers for sure. And then as those computers have issues, our tech support team will be ready to help address those issues, much like we did in the spring.
Okay, great, thank you. The next question, is a face shield acceptable for students and or for teachers?
Generally speaking, a face shield alone is not sufficient. A face shield with a face covering is a great combination. And there may be certain circumstances where, you know, a student, so speech language pathologies, an example, I guess, that comes to mind, where it's important for a student to be able to see, or it's important for the adult to be able to see the student's entire face to be able to support their needs. So then a properly fitted face shield could be something that's in place, perhaps in addition to a plexiglass barrier. So really just thinking about trying to have something in addition to the face shield alone to be sure that everyone's safety is taken care of. Justin, I don't know if that covers it or if there's more to the face shield concept. Okay.
Okay, thank you. Will there be in-person physical education classes in the elementary schools or at Mount Abe?
So special areas in general, so PE, art, music, library, and guidance in certain circumstances, those are not going to be the priority for in-person instruction. Again, we've said we're going to really focus our efforts on the core academic areas, thinking in particular literacy and math, and to some extent science and social studies. Those are going to be where we're going to focus our energies, because we have such little and precious in-person time, and because we're going to need many hands to make even our core academics function properly in a hybrid reopening. Having said that, there may be limited circumstances where some PE might be able to happen for some students in person, but it will need to be outside. If there's any kind of physical activity where they can keep distance, if it's inside, there can't be physical activity. So that's sort of the idea that encompasses PE, art, and all those special areas.
Okay, thank you. The next question, will educators be Zooming in students on remote learning days so in-person and remote students interact with one another? How will those remote learning days work?
So I guess to that, I would say maybe. I think that, again, is going to be an individual teacher decision. I don't think it's going to be a district decision that's going to happen across the board. I think different teachers have different levels of comfort. Different students have different levels of being able to work in that kind of environment. It's an option. It comes with some challenges. And those that feel like that option is going to work well enough to overcome those challenges may pursue it, and others may not. Katrina, feel free to add if there's more to that.
Okay, thank you. How will kids who refuse to wear a mask or wear one appropriately be corrected?
So like we were talking before, we're really going to be working to help educate students, help them understand why the masks are important, the proper way to wear them to keep everyone safe, and take that route. That's definitely the preferred route. And again, if a student's being defiant and there's no clear evidence of what might be getting in their way other than defiance, then that may need to sort of trigger our discipline system. But we don't anticipate that happening. We don't want that to happen. And that's not going to be our first approach.
Okay, thank you. What type of documentation would you require from a doctor in order for a young child not to have to wear a mask?
I think the documentation we're looking for, and again, Justin, if there's some specifics to this I don't have, feel free to add, but the documentation we're looking for is sort of an understanding of what's the underlying medical need that makes wearing a mask problematic, combined with their help in developing a plan for an alternative, for something else that could work to help keep that child and everyone around them safe. And that's where the conversation and communication with our school nurses is really important, and we can work collaboratively with the physician to have a plan in place that we can all feel good about. So for example, if a particular student has an underlying medical condition that means they can't wear a mask, do we get a properly fitted face shield for them and have a plexiglass divider between them and other students they may be working with or other adults? Maybe that's the plan that works for that student, or maybe there's something else that would be better.
Okay, thank you. This question is about field trips. Will remote students be allowed to join field trips? Will field trips be whole class, or would they be group A and group B trips? And also regarding full remote learners, will they be allowed to participate in sports?
All right, that's I don't know, is that a 4-parter maybe? We'll see if I can get them all, but let me know if I miss one.
I'll let you know if you miss something.
All right. So the answer is, and in some ways it's a 4-part question, but it might be only a 2-part answer because I think it applies across a couple of those questions. Students that are remote are not going to be disallowed to participate in anything that the school is providing, right? So for the field trip example, and it follows with sports as well. If a class is going on a field trip, the students that are entirely remote should be able to access that field trip. The trick with field trips is all of the spacing regulations, the masks, etc., all still apply. So it gets tricky when, say, Mrs. Jones' 3rd grade class is going on a field trip. For her to bring her entire class together to go on that field trip presents some complicating factors. If she can bring that entire class on that field trip and keep distancing, maybe that's something we can consider. But the logistics around field trips are complicated, not because some students are remote or the complications of bringing them in, but because it's a numbers game and a spacing game that we need to make sure are in place. So absolutely yes, they can access field trips and they can access sports, and we encourage them to. What were the other 2 parts?
I think the only thing you missed, and I think you sort of addressed it as far as the numbers, if field trips will be designed to be group A going and then group B going, or together. It sounds like it really depends.
It depends on the field trip and on what it takes to make those regulations be intact.
Okay, great. For riding the bus, how will students be able to socially distance on the bus, and will temperature checks be required prior to boarding?
So to be clear, it might not be possible for students to physically distance on the bus. Again, buses are at step 3. There's no restriction on the number of students that can ride on the bus other than the bus's allowed capacity. So having said that, students are going to be expected to wear masks. They are going to have hand sanitizer as they're getting on the bus. And we are encouraging people to bring their kids to school in some other way if they can to minimize the numbers, in which case we'll then spread the kids out as much as we possibly can, right? So our ability to create distance when there are 10 kids on the bus is very different than our ability to create distance when there are 50 kids on the bus. We're going to dial that up and down as we need to, given the number of students riding the bus. and we're gonna have attendance on the bus, so we know who's riding the bus that day, and we're gonna have assigned seats to try and make sure that we know who was where in the event someone does test positive. Did that address the question, or am I missing something?
Nope, I think you got it. Thank you. Okay, this is a calendar question. So what about the other professional development and parent-teacher conference days throughout the school year? Is it only the Thanksgiving break and March in-service days that are changing?
So at this point, that is true. So the 2 parent conference days aren't moving as of right now. So those are, we consider those in-service days. So those are not days that teachers are instructing, but they are days that teachers work. And so those days are still intact. The one other day that is in question right now, which is only an in-service day, it's already, or which is actually currently a day off for both staff and students, is, I think it's October 16th. So basically right now, and again, this is depending on what happens with the legislature, this assumes the legislature acts to reduce the required number of days from 175 to 170. We, with the way sort of the in-service days were shuffled to front load them, we end up needing one more in-service day to sort of adhere to the contract language in the teacher's contract. One option is for that in-service day to take place on October 16th, which is currently a day off for staff and students. That would remain a day off for students, and it would be an in-service day for staff. That's one way to get an in-service day back. The other option is to add an in-service day after the last day for students. And those 2 options are both viable options. They each have their own pros and cons, and we're going to need to figure that out. Otherwise, all the other in-service days, parent conference days, et cetera, will stay where they are. It's just a matter of that October 16th day or the day after the last student day that we need to figure out still.
Okay, thank you. Can you talk a little bit more about core instruction, specifically for middle school? Which classes are considered core instruction, and what about which specific classes will they not be getting instruction in?
And I'll turn it over to you for the middle school.
So the core instructional classes will be math, English, social studies, and science. All students will be getting those in grades 7 and 8 all year long. And at various points throughout the year, we're doing our best to make sure that students have access to PE so that they can do some modified movement as well as art and health. So classes that will not be available to them this year are the world language offerings, the exploratories that we are really excited about running that we won't be able to this year, band and chorus.
Okay, thank you. Okay, our next question. Kids will likely be at more disparate levels coming back from the summer than other summers in terms of their learning. How will teachers assess student levels so that kids don't have to relearn or review things they may have mastered in the spring and summer?
Katrina talked a little bit about this before in terms of formative assessments. I don't know if you have additional details to add, Katrina.
Not a whole lot at this time. We definitely are using a lot of our collaborative time next week and the week after to tighten those plans up. But we are looking at easy screeners, things that will just be comfortable for the kids, not anything that's going to hit them real hard right from the very beginning. We definitely want to take our time and ease into the classroom and make sure that all of their social emotional learning needs are met immediately, and then work to assess where they are, particularly in literacy and mathematics, based on where they left us before.
Okay, thank you. The next question, often in elementary school learning, one teacher in each grade teaches math to both classes and the other does reading. Will this happen? Will that happen this year?
Possibly. So I know some teachers have already been in communication with one another and talking about ways in which partner teachers. So another example is we have multiple, say 3-4 classrooms in a school, and those 2 3rd and 4th grade teachers work together and think about how to support one another with their instruction. So there's still absolutely opportunities for that. One example is one of them teaches math and one of them teaches literacy, but there are other examples that could work as well. So I think, again, you know, creative partnerships like that are certainly encouraged still, but may not be happening everywhere. I don't know if you have anything to add to that, Katrina.
Nothing more to add. Thank you.
Okay, thank you. Can you talk a little bit about providing internet to students and staff who prefer to stay home by way of hotspots or USB global modem or things like that?
Yeah, so you know, different options are available depending on where families are. So we worked really hard in the spring to try and connect families, and our survey that we sent out, which we had over 1,000 responses to, indicated that something around 96% of our families had sufficient internet strength to support, you know, video conferencing, things like that. And for that 4%, we really want to continue to work with those families and understand, is an affordability challenge, in which case we can try to connect them with, you know, various supports to help overcome that challenge. Is it simply an availability challenge that they can't have access to strong enough internet? In which case we can talk about options that exist there. So it's sort of a case-by-case basis, but we definitely want to hear from those families and do what we can to support them. And I would encourage them to, you know, probably reach out to their building principals, the best point of contact, to say, this is a challenge for us, and they can work with their building principal to try and overcome those needs, those challenges.
Okay, thank you. The next question, if my child contracts COVID from attending school, will the school help to support our family? Who will be liable for the medical expenses?
Yeah, I think from a liability standpoint, my understanding is that schools nor other organizations are likely to be held liable for someone contracting a virus like this, much like we aren't liable when someone catches the flu. The other challenge being, it becomes really difficult to pinpoint exactly where someone might have contracted a virus like this. So for all those reasons, it's not so much trying to play a blame game and understand who's going to be liable for what. So, but for us, for sure, we want to support families that are going through this, right? So from my perspective, the support is more, what does your family need to support remote learning while the child has to be home? Do you have Wi-Fi capabilities? Like those sorts of things are the ways in which we would look to support a family who's going through that, not so much that we'd be paying for their medical bills.
Okay, thank you. If when we do go back to full-time in-person learning, would you imagine that Wednesdays would remain remote, with school being Monday to Friday except for Wednesdays?
Yeah, that's something we'd have to figure out. I think both options would be available to us if we start to bring more students back. There are pros and cons to each of those options. So I wouldn't pretend right now to say with confidence exactly which of those options is what we would pursue. We'll have to sort of assess the situation, because again, you know, this isn't so much a black and white. The numbers are exactly where we want them to be, and we can bring everyone back and feel confident. Nor is it, I mean, it would be clear if the numbers are such that we can't continue to operate in person at all and we're going fully remote. Like both of those possibilities exist, and it's really going to be kind of a range. So if it feels like not being in school on Wednesdays is needed to bring more students back in person safely, we're not going to eliminate that option. And having said that, if we can bring all, let's say, K-5 students back in person 5 days a week, that's the desire, right? There are a lot of challenges operating in a hybrid that go away when all the students are back. So there's a motivation to bring students back, but we have to do it safely. So we're going to keep all of those options on the table until the time comes to make that decision.
Okay, thank you. Can you talk a little bit about what classrooms will look like for students?
Sure. So I'll sort of describe my vision for a classroom. So I'm picturing an elementary classroom that has 8 or 9 or maybe 10 students in it. Some may have as many as 11. And in that classroom, students are, you know, sitting at desks or tables. they're a fair distance away from their peers. They have their devices handy. Their classroom teacher is in the room delivering instruction, individualized support when they're working at stations or something. It looks in many ways like a typical day with a much smaller class, kids spread out much more. Everyone has their mask on. Maybe there's a plexiglass partition here or there, but perhaps not. And the learning is happening, and I'm picturing smiling faces.
Okay,
or smiling
thank you.
eyes, I guess. Katrina just pointed to her eyes, right? Because their mouth will be behind the mask, but you can tell by their eyes.
Okay, thank you. Can you talk a little bit more about the buddy teachers? Who will be serving in that role? Will it be instructional assistants, specialists, coaches? Will the coaches and coordinators be enlisted to help in the classroom?
Yes, to all of those, right? So we have to really be looking to all of the folks that we have available to us to help make that work. And so we're really looking to, I mean, it's a priority to have this system in place for all the reasons we talked about before, to manage the in-person and remote, but also to be a support system in the event that someone has to be absent. So it's a high priority. And if we have staffing that can attend to that high priority and still have instructional coaches doing their thing and interventionists doing their thing, great. If the need changes and we need to pull in folks from those other positions, that's what we're going to do, because the priority is to make sure we have a really robust buddy system.
Okay. There's my next question. If childcare is provided in the building with kids also being transported via the bus, how does this limit exposure for the in-school learners on their assigned days? So I guess, how will those groups be separated?
Yeah, so they'll be separated physically within the building, so they'll have their own space. There's talk of, their own bathroom, their own entrance. They're not going to be mixed with other students in the building. So very considerable effort will be put in place to keep those students distanced. Mandy, I don't know if you have any more. I mean, you've been living this since March. You've been doing it. 100 kids in a building, basically in one wing at Mount Abe at the same time. You feel pretty confident about the practices to keep students in cohorts and mixing pretty infrequently.
Yeah, and in fact, we've talked about this. MAUSD, we're so grateful to be, a part of the school district where we have more of a head start than many of the other schools and districts throughout the state, simply because we have been doing this. So these are such thoughtful questions that are coming from our community and our parents. They're really, really smart questions and things we've been thinking about for 4 months. So we'll be working to ensure that all the guidance and the safety measures are taken, and that we create an environment that is physically and emotionally safe for our kids.
Great, thank you. What are some of the things the community can do to support students and teachers? How will the district communicate this?
Good question. So the first thing that comes to mind for me is go to our website. You're going to be prompted to perhaps sign up to be a substitute, and that would be wonderful. So we need substitutes for support staff. We need substitutes for professional staff. So that would be a tremendous help to know that we have a growing substitute pool. Beyond that, it becomes tricky because of the limited access physically to the building. So we have to give some more thought to ways in which the community might be able to help. But that's a good idea to think about creating a list of ways that the community can support their school system in a way that complies with the various regulations that we have to adhere to. I don't know if anybody else has a great idea they want to share right now, but substitutes came to mind for me right off the bat. I'm not seeing anyone jump at it, so.
Okay, we are just about out of time, so we're going to ask 2 more questions. And let's see. Okay, will MAUSD hold another district-wide meeting like this one just before school starts to help answer some of the questions that are still outstanding?
It's a great idea. We don't have anything planned at the moment, but we do have, so one of the action teams that I mentioned before is a communications action team. And I'm seeing at least 3 members of that communications action team on my panel right now on my screen. So I think that's something that committee can consider. And if that seems like a good idea, then we can get some plans in place for that.
Okay, and our last question, where will the Q&A be posted and will this presentation be posted?
So we'll have some links available through our website. And in addition, we're looking at something a little more comprehensive than a Q&A, but it might include Q&A, looking at some examples from our neighboring districts and trying to basically cherry pick from the different things that we like the most to create a really robust sort of support structure, probably linked through our website, to offer to families about all things COVID and reopening and lots of resources. So more information will be shared once we're ready to launch that. So be looking for that. In the meantime, go through our website is our best bet. And if there's a particular question you have that's still lingering, covid.help@mausd.org is a great place to go, or email someone that you know in a leadership position in one of the schools.
Okay, thank you so much. So that was our last question. Patrick, I don't know if you have any other closing remarks before we sign off this evening?
Yeah, I really just want to, again, thank everyone who kind of stuck it out for the 2 hours tonight. I hope this was really useful. It's helpful for me every time we sort of talk through the details. It gets a little more clear in my own mind, and I hope it's been helpful to everyone else. And really, I just want people to know we feel really strongly about the plan we have in place to bring students back. We feel like it's a right blend of keeping everyone safe and healthy and attending to their physical needs, their social, emotional, and mental health needs, and for sure their academic needs. And most importantly, we're just really looking forward to welcoming kids back in person. I'm sure the adults miss the students being there in person more so than the kids miss being there. We are ready for students. We're excited to have them back. And we're going to do everything we can to take really good care of them along the way.
Thank you. And thank you to all the panelists and to Patrick for all of your work.
Thanks, everyone.
Thank you.